Thursday at 9 o'clock on UTV. Now, our next question is on health, an area covered by devolution settlements in Scotland, Wales and Northern Ireland. And to put it, we have Sindhu Novell, who's been a hospital nurse for 12 years. Mrs. Novell.
My question is, what are the party's visions for the future of healthcare in Britain? In particular, how would they address the cost pressures arising from an aging population and more expensive new treatments?
Thank you very much indeed, Mr. Brown.
To help people live at home, to give them the urgent care needs that they have and see them met, for example, by home helps and health visitors, so that people who want to stay at home don't have to go into institutional care. We've seen a revolution, large numbers of people living longer, and that's a great thing, but people need the help in their homes so that they don't have to go into nursing homes or into old people's homes. My priorities for the health service are that we give people now personal guarantees. And that is that every individual patient will know that they'll get a cancer specialist seen within 2 weeks if they need it. They'll get a diagnostic test within 1 week and the results to them. They will also be able to know that their operation will be within 18 weeks if you're any patient in need of an operation. You'll be able to see a GP in the evenings at weekends, something that wasn't happening. You'll be able to get a free health check-up on the National Health Service. I want people to know that public services are personal to people's needs, and that's why we need to give these guarantees to individual patients, and that's what we're going to do from now on.
Well, first of all, can I thank you for your incredible service to the NHS. I think the NHS is a wonderful, wonderful thing. What it did for my family and for my son, I will never forget. I went from hospital to hospital, A&Es in the middle of the night, sleeping in different wards, in different places, and the dedication and the vocation and the love that you get from people who work in the NHS just, I think, makes me incredibly proud of this country, and so thank you for all that you've done. I think it is special, the NHS, and we made a special exception of the NHS and said, yes, there are going to have to be difficult financial decisions elsewhere, but we think that the NHS budget should grow in real terms, i.e. more than inflation, every year under a Conservative government. My vision is that we improve it, we expand it, we develop it, we make sure that it's got more choice and more control for the patient. But we need to do some short-term things too, like make cancer drugs available to people who need them. There's some tragic cases now of people just not getting what they need.
Well, of course, the easy thing is to say how much we all love and depend and rely on the NHS. The difficult question, which is I think the one that you're addressing, is how do we protect the NHS, which we all rely on, maternity services, A&E departments, GP services and so on, when money is tight? And I think it's a little bit like the earlier discussion about equipment in the army. The priorities at the moment are all wrong. The last year, under this government, they've just employed 5,000 more managers in the NHS. Yet the maternity ward in the NHS hospital where my third son was born just over a year ago is threatened with closure. This government spent £12 billion on a computer system in the NHS which doesn't work, and yet I was in Burnley the other day. I think Jacqueline was saying that you come from Burnley. As you know, Jacqueline, they've closed the A&E department there. I think you have to now travel 25 miles to Blackburn. So what is going on? We're closing A&E departments and maternity wards and wasting money on computer systems and bureaucracy. I want to turn that on its head so we can protect the NHS that we all rely on.
Brown.
Well, I've just got to say that my commitment to the NHS is that we will give people these personal guarantees. The main source of employment in the NHS is more nurses. We've got 80 to 90,000 more nurses across the United Kingdom. We've got 30,000 more doctors. We've got the best equipment now in some of our hospitals. Remember the situation before 1997 when people had to wait 2 years for operations. It's now a maximum of 18 weeks. And yes, it is our priority that we will support the frontline services, health, the National Health Service, education and policing. These are the frontline services that people depend on. We will make sure that that finance is there. David says he will support the National Health Service, which assumes he will not give the same guarantees to education and policing as I asked him earlier this evening. But I think the main point to recognise is this. David will not give you the guarantee that you'll see a cancer specialist in 2 weeks or the guarantee you'll have a GP in the evenings and weekends. These are personal guarantees written into the NHS Constitution that we will give.
The point is that today, actually, the number of nurses is going up, the number of managers is going up 5 times faster than the number of nurses in our NHS. And the government has had 13 years to fix these problems, and it hasn't done. And Gordon Brown talks about cancer, but what he's not telling you is that there are people in our country, there was a case the other day of someone who had to sell their home to get the cancer drugs. And the Prime Minister, the government, is about to hit the NHS, Britain's biggest employer, with this national insurance rise. It's going to take £200 million out of our national health service. We say stop that national insurance rise and instead spend the money on a cancer drugs fund so people can get the drugs they need. Talk about guarantees, but the fact is for some people waiting 2 weeks to see a consultant is too long. We need a faster, choice-driven system, but the drugs have got to be there when you need them. They're not always right now.
This is a phony debate. This is pretending that somehow there are billions and squillions of pounds around that we can continue to pour into our NHS. Every man, woman and child in this country spends £2,000 on the NHS through our tax system. I want to judge the NHS about how it helps me and my family when we're ill and we're sick and we're in need of NHS care, not just by numbers plucked out of thin air. David Cameron, you simply cannot seriously suggest that we should believe that you can cut the deficit immediately as you want, then a whole blizzard of tax breaks, including a great big tax break for double millionaires in the inheritance tax system, and provide huge lashings of extra money to the public. You might be able to do one of those things. You can't do all three. So I want to say to people, let's be straight with you. We're going to have to find savings in the NHS. I want to see, for instance, strategic health authorities, which is a layer of bureaucracy, stripped away altogether and use that money on the frontline NHS services, which are so important to us.
The point is, we have made a special exception for the NHS for exactly the reason that Mrs Neville gives, which is there are more older people, there are more expensive treatments, there are drugs budgets that are going up, and we say you need that extra money to even keep going with the NHS, and that's why we make the exception of the NHS and say that's the budget to go up. Now, what Gordon Brown is not telling you about the situation with cancer, cancer drugs and cancer outcomes is after all the things he's talked about, all the money that's gone in, our death rate from cancer is actually worse than Bulgaria's. So all that's happened has not actually improved the outcome, which is what matters.
Gordon Brown.
If people get early detection, and that means screening, I had a lady write to me who said that she would not be alive today if we hadn't introduced screening and we hadn't given the chance to see a specialist within 2 weeks. What David is not telling you is that while we are using the national insurance to pay for health, to pay for policing and to pay for schools, he won't give them the guarantee on policing and schools.
Mr. Cameron.
And now on the health service,
Mr. Cameron.
he cannot give us a guarantee
Brown,
about specialists for cancer.
The national insurance increase, which Gordon Brown has said is definitely coming in, that will take £200 million out of the NHS. He's not replacing that money, so he would have less to spend on cancer drugs. I have a man in my constituency called Clive Stone who had kidney cancer who came to see me with 7 others. Tragically, 2 of them have died because they couldn't get the drug, Sutent, that they wanted, that was on the market, that people knew was a good drug. That's a scandal in our country today. So stop the national insurance rise, use that money for the cancer drugs and help people so our outcomes can be amongst the best in Europe rather than, sadly, amongst some of the worst.
All I would appeal for is just a bit of honesty in this debate. I mean, people know that money is tight. People know that you can't promise something for nothing. You can't say you're going to fill the deficit tomorrow and you're going to give lots and lots of tax breaks to people, inheritance tax breaks for double millionaires, tax breaks for, 1 in 3 hand-picked married couples, and also extra money to the NHS without explaining how you're going to do it. I say again, there's something wrong.
Mr. Cameron, thank you, Mr. Clegg.
Nick Clegg is promising a £17 billion tax cut. Now, we're saying stop the waste of £6 billion to stop the national insurance rise. I would love to take everyone out of their first £10,000 of income tax, Nick. It's a beautiful idea. It's a lovely idea. We cannot afford it. So it's all very well posing.
Please do.
I tell you how we pay for it. We would, for instance, stop the huge unfair loopholes that only benefit the very wealthy at the top of the tax system. At the moment, the top 10% earners in this country get twice as much tax subsidy from all of the rest of you when they make contributions to their pension pot than everybody